Hello, everyone, and welcome to the Vaccine Team podcast. We are excited to be bringing you these interviews with experts in their field as we all talk about rolling out the vaccine and should we get it and what's going to be happening. And we know you have so many questions. So I am honored right now to be joined by Dr. Akiko Iwasaki, and she heads up the immunology department at Yale. Doctor, thank you so much for being with me.
Thank you, Kara, for having me.
I just want to share with our listeners and viewers that something I was sharing with the people in the newsroom here, that you were the first person, one of the first people we had on before the world shut down. And I remember doing a very long interview asking anything and everything for Facebook Live that later on hundreds of thousands of people had access to all over the world. And it was so new at that time. And I remember you saying, we shouldn't really go on a plane and they're probably going to have to cancel the parades. And at that time, it seems so crazy. Like, of course, they're not going to cancel the parades. Really? Are you sure? They're outside. And then a few days later, lo and behold, they canceled everything. So we've all had a big wake up call. Obviously, you knew something we didn't at that time. Bring us up to speed. What have you been doing all this time now? I know your focus is on vaccines. That's your expertise.
Right. So since I spoke to you last time, which was, I think, March.
Yes.
Right. My lab has been working really hard to try to understand the immune response to this virus and trying to identify potential therapy based on what we're learning. So we've made a lot of progress with respect to understanding the immune response, such as, how it differs between men and women and between different age groups.
Well, let's talk about that because that's something people are worried about. As soon as someone gets it, a doctor, a nurse, did you have any side effects? We're all nervous because it's new. And I think people think, oh, it's new. We don't have a lot of data. What have you found?
Right. So the mRNA vaccines are indeed new, but it's actually been tried in multiple different settings before with different infectious diseases like Zika virus and influenza virus and so on. So it's not entirely new. We have had data for decades in animal models as well as phase 1 clinical trials. And so the safety and the effectiveness of this type of approach was known before. But now, of course, we're applying it to the new pandemic, and the efficacy turns out to be amazingly great for both the Moderna and Pfizer vaccines. So I'm very excited that this new platform might become a major vaccine platform going forward for other vaccines as well.
When you say you're excited, I even saw you smile. I want to share that with people. What makes you so confident that people should take this? And is it safe?
Right. So the safety and efficacy were studied rigorously using, tens of thousands of volunteers who participated in the study. And essentially what they found was that the vaccine is very safe. And it's highly efficacious, upwards of 95% efficacy for the mRNA vaccines, which means that it's an incredible feat for the science, really, to have a vaccine that's so effective and even effective in people who are at the high risk, such as older adults. And so, I don't think we can expect anything better than this. It's really a great vaccines that we can, really encourage people to get as soon as they're eligible.
I know a lot of healthcare professionals have already been eligible. Are you one of them? Have you had the vaccine yet?
Oh, I wish. I'm waiting for my turn.
Okay. But you will get it.
Yes. So my lab members, because they work directly with the virus, they have gotten the vaccine and they're all very happy and grateful.
Does it mean if we get the vaccine? My mother it was in one of the groups that was able to get her first shot, and then she's going to get her second shot. And a lot of questions, people are like, oh, once you have the shot, can you go back to hugging your grandchildren? Can you go back to living the way you lived before the pandemic?
Right. So we have to be careful not to do that immediately. The reason is the vaccine takes a little while to educate the immune response so that we are actually indeed protected from infection and disease. So it takes at least 2 weeks or so for the antibody responses to kick in. after the first shot. And then you really need to wait 2 weeks after the second shot to be, in this effective phase of 95% efficacy. That was measured 2 weeks after the second dose. So we still have to keep, mask wearing, distancing until at least 2 weeks after the second shot.
And then 2 weeks after the second shot, can you go on a trip? Can we go on that plane you didn't want us to fly on before?
Right. Yeah. So right now, one more mystery that we don't know yet the answer to is how effective the vaccines are for preventing transmission. So these data are forthcoming, and we're just waiting for these data to arrive. But essentially, even though it's 95% efficacy with respect to prevention of disease, we don't know whether a person who's vaccinated is no longer able to transmit the virus or not. And so those are the type of things that keeps me, from saying, okay, just go out there and get on the plane and enjoy yet. Because until we know that the transmission is also significantly reduced by the vaccine, we should still keep wearing the masks until we know that.
So go ahead and book the trip, but you're going to wear a mask, or but can you live a little bit more? Can you feel safer if you get this vaccine?
Absolutely. And that's what the whole point of the vaccine is, so that you can sort of return to what you were doing, not in the same way you did before, with caution, but eventually, if enough people are vaccinated, we can return to that life where you can hug your grandchildren and hold hands with people or whatever. So, it's a matter of time.
Okay. So I want to get a little bit micro about when you mentioned hugging the grandchildren. That was my original question. Assume that you've waited the 2 weeks after the second shot. Can grandma come over and sit next to the grandkids and hug them again?
Yes,
essentially grandma is protected, right? I know you said that maybe she could give it to the kids. I don't know. Can she hug the family? If family has been isolating from grandparents, can they now not isolate?
Yes, I would think so. I would think that it's definitely safer to do 2 weeks after the second dose. But if you are in a large indoor crowded setting, you still should be wearing a mask because of what I just said about the transmission risks.
Absolutely. But maybe there's people who haven't seen their kids and their grandchildren in months. So, what I think that you want people to understand is wear your masks, wash your hands. That doesn't stop, but the vaccine just means you are protected at least 95%. Now, I also read that we really should be promoting the idea that when it's 95% for serious, for not getting COVID, but it's 100% for not getting serious disease. That even if people, that 5% that might have still gotten COVID, they didn't get the level that would kill you. So it's 100% effective, at least in what I read, in saving your life. Is that true?
Absolutely. And that's what's remarkable about these vaccines is that, it not only kind of prevents 95% of the symptomatic infection, but for these vaccines, there were no severe illnesses, occurring in the vaccinated cohort. So it is true that it is preventing severe disease from happening at the same time as, preventing symptomatic infections from happening.
So what if you've already had COVID? Like myself, I suffered from COVID over the winter, and my family, I had a more severe case, I think, than certainly than my family. My son, very mild, my husband, very mild. My daughter never got it, continued to test negative. I was pretty sick for about a week, like a bad flu. Nothing that I would have to go to the hospital for. But now I have these antibodies apparently for at least 3 months. Do I get the vaccine? Do people who've already had COVID get the vaccine?
Right. So my recommendation is to get the vaccine even if you've had COVID, because the ability of a person to mount an antibody response after natural infection with SARS-CoV varies between person to person. So you may have gotten a very good antibody response, but another person who recovered from COVID may have gotten very little antibody response. So without knowing exactly how much antibody you generated, and the fact that you probably don't have a very long-lasting antibody from recovering from the infection, it is safer for you to get the vaccine when it becomes available. you don't have to, hurry up and try to get it as soon as possible because you are likely protected from your existing immunity.
Well, and the same question, you're not sure if we have the vaccine, if we couldn't still be a carrier. Is that the case also right now? Even though I've already had COVID, people who've had COVID, could we all still be carriers, or can we no longer transmit the virus?
It's very unlikely that you're a carrier of the virus. Most people who are immunocompetent, like yourself, would be able to clear the virus within a couple of weeks. So you really shouldn't worry about being a chronic carrier of the virus. However, there are certain individuals who are immunocompromised who are known to carry the virus for a long, extended period of time. And if you do belong in that category, you should definitely talk to your physician and make sure that you're not transmitting virus to others.
What if you still test positive for the virus? I've heard some people will continue to test positive even though they're no longer contagious.
Right. So the PCR testing that is used to test for the viral presence is very sensitive. So sometimes you do get a situation of the RNA, viral RNA is what's measured by the PCR. Your RNA might be positive, but you may no longer be carrying an infectious virus. And so really the level of the PCR reading is very important to understand, because if you're having a very high level of PCR test positive, it may mean that you're still infectious, whereas a very low level of PCR means you're likely no longer infectious, but just having the lingering RNA.
Okay. Which I'm not sure that they tell you when you go through the drive-through test. They just tell you positive or negative. But I guess at your level, in your lab, you'd be able to look at that. But I know that a lot of people have said, oh, did you have to get tested to go back to work or school? And my answer was no. The CDC is not recommending people to get tested and prove they're negative before they return. It's more of a time of 10 days or 14 days, depending on the state or the CDC.
Exactly. So for vast majority of the people, that works because, like I said, you clear the virus within 2 weeks' time, infectious virus. So unless you're getting another bout of infection, some people do get reinfected. And if you're getting another symptom, like COVID-19 like symptom, you definitely should seek testing and care. But unless you're sick like that, I would think you're no longer transmitting.
Okay. So what percentage of the people will need to have the vaccine before we can get herd immunity? Or how do we get to herd immunity?
Right. So the mathematical modeling predicts 60 to 70% of the population being immune to confer herd immunity. So that means that, we still have a ways to go there, because the vaccine rollout, even though it's increasing, it's still a small fraction of the people that are getting vaccinated at this time. So it's still not, enough of a herd immunity to kind of not practice mask wearing and social distancing and so on. We still have a little bit of ways to go.
What about vaccinating the very frail? I did see a newspaper article that talked about some people in Europe who were over the age of 80, very frail, and they ended up dying after getting the vaccine, and that maybe this needs to be looked at, and that the very, very frail maybe shouldn't be vaccinated. It was just one article. I want to ask you, since this is what you study.
Yeah. So, there are lots of things that happen to humans on a daily basis that may or may not have anything to do with the vaccine, right? It's really hard to assign, death as caused or related to the vaccine, even though it happens around the same time. So in terms of like why someone might get a severe reaction or like, for example, there are allergic reactions that's been reported as well. And potentially death around the same time. These are something that we definitely need to look into. But as far as I understand, of the tens of thousands of people who got the vaccine in the phase 3 trial, there really wasn't any safety concerns. And also the older population generated very good immunity. Despite the fact that most of the time, like for example, flu vaccines, it's very hard to generate a good immunity in people over the age of 65. So the fact that the mRNA vaccines were able to do that, again, gives us hope that even for older folks, we should be giving this vaccine.
So will we need to get vaccinated every year, or how long does the immunity last?
Yeah, that's a really good question. We've only started, vaccinating people in the last month or so. So we don't have the sort of how long question answer yet. It's possible that we may need to get another booster shot in a year or two. We don't know. We have to keep monitoring the infection rates and antibody levels and so on. But right now, I don't think we need to worry too much about, having to get the vaccine booster every year. For the influenza vaccine, we need to do that because the virus itself changes every year. And that's why we need to do it every year. But with this virus, it's unlikely that it's going to mutate so rapidly that it requires a new vaccine every year.
Yet there are new variants, and that's certainly making the news. Will this vaccine still protect? What do we know about that?
Right. There are definitely these variants that are becoming dominant in different populations around the world. And so immunologists like myself, we're, very much involved in testing whether the vaccines are effective against these variants. And if so, like whether the efficacy is remaining very high or not. So these are really ongoing studies. We don't know exactly the answer to this, but my suspicion, my guess from what I understand is that the current vaccine should be able to cover these variants for now. Some of the mutations that are accumulating appear to be escaping some of the antibody recognition that happen in people who recover from current version of the virus, as well as vaccinated people. But we also have, in addition to antibody, we have T cell response, we have memory B cells. There are multiple effector functions that are engaged by the vaccine. So I'm hopeful that these variants are still well covered by the existing vaccine.
I know that everyone is working to get the vaccine rollout better. I think we can all agree it needs to be more. And that's something I know the new presidential administration wants to focus on. Connecticut's trying to get more. So assuming that we get more and that eventually just young children with no risk factors can be vaccinated, is that important? Will you be vaccinating your own children? And is it just like adults? Can we give it to the kids and not worry?
Right. So there are already clinical trials going on for children to test for safety and efficacy. Obviously, safety issues are a major concern for children because they themselves aren't really in high risk group. So the benefit must outweigh the risk, obviously, for vaccines. And so I'm eagerly waiting for the results of those trials. But if it's proven to be safe and effective, yeah, of course, my children will get the vaccines.
So that's something important for people to know yet. We really don't know how this performs for children yet. And at this point, children aren't being recommended to get vaccinated anyway, because they're not normally at high risk. So at this point, it's a big question mark for kids.
That's right. But I believe that the data should be forthcoming soon. So
Okay.
we should know, hopefully in a couple months, whether or not the safety and efficacy holds in children.
So I want to start ending here, but basically, if you're getting signed up to get the vaccine, I know some people are dying to get it. They're so excited. For those who are a little bit on the fence, what would you say to them and about the possibility of side effects or anything like that?
Right. So it's during the phase 3 trial, the side effect has been tested, and some people do get side effect, soreness of the arm, fever, just fatigue for a day or so, and that's been reported, especially after the second dose. And so that's something we should expect going in, and you shouldn't assume that you'll be totally fine and not feel anything. You might feel these things for a day or so, but vast majority, if not most people, recover from these types of side effect within a day. So even if you might feel this way, just know that it's normal. and that you will get through it, and just sort of rest, and maybe you want to take a day off on the second shot, because some people do experience some side effects, but it just means that your immune system is kicking in, and you should embrace that. And, I'm one of those people who are really waiting to be vaccinated and excited, because of the safety and efficacy profile of the vaccine. So I encourage everyone to go and get it.
I've heard sometimes, and I want to hear your opinion on this because I hear different things. If you are having a slight immune response, a fever is actually a good thing, right? It means it means your immune system is working. So should you not take Tylenol or Advil or something to make yourself more comfortable if it's just a low-grade fever? Does that hurt the efficacy of the vaccine, or should you just take it so you don't feel anything?
Yeah, so a colleague of mine, Dr. Craig Weiland, actually published a paper last week, which was testing this exact question, in the context of the SARS-CoV-2 infection in mice. And so, non-steroidal anti-inflammatory, such as Advil, when he injected it into the mice before the infection, the mice didn't develop antibody very well. So this means that, we may need to avoid those NSAIDs during those reactions. And if you can tolerate it, I wouldn't take anything, just sort of rest and,
Okay. Let
like I
your
said,
body have its response, because that means you're making antibodies. It's similar when
exactly.
you have morning sickness and the doctor tells you that's good. That means your body's making hormones.
Exactly. So if you can withstand morning sickness, this is nothing.
Okay, exactly. Doctor, before I let you go, is there anything else? We always appreciate your brilliant mind. So if there's anything else you want to say that people need to understand about this vaccine, since you have worked so closely with it.
Right. Yeah. So I really can't emphasize enough the importance of vaccine for us to all return back to, how we used to live before the pandemic. And I know that there is some fear and, uncertainty in some people's mind, but from my perspective, these vaccines are incredibly safe and effective. And so I think we should feel comfortable, and especially knowing what the side effect might be, what going in, so that you're not surprised by it. But essentially, it's your immune system kicking in, and embrace it. Within a day or so, you will be fine. And then you will have sort of resistance for a long time. So I think I really can't encourage people enough to get the vaccine.
All right. Thank you so much, Dr. Akiko Iwasaki, for being with us on the vaccine team as we roll out these messages. We appreciate you being with us. For everyone listening, I'm Kara Sundlin with Channel 3, and we will be answering your vaccine questions on the Vaccine Podcast in the weeks to come. Thank you so much, Doctor.
Thank you, Kara.
Talk to you soon.